Hi everyone, I'm Patrick Miller, a well-controlled diabetic for 18 years. Having had the disease for a longer period of time, I wanted to give some information to those that are newer to this disease, which could be helpful. This is the Diabetic channel, where we provide useful information for diabetes. We are trying to get to 500 subscribers, and subscribing to the channel could really help us out. If you could hit the subscribe button, that would be awesome. Today, I wanted to make a second video for those that are very newly diagnosed and add 3 more things to the list of things that I had spoken about. I'll put a link to the original video that listed 10 things I wish I had known when I was first diagnosed. The first thing is there is now a drug called teplizumab, which is sold under the brand name Tzield, approved by the FDA in November 2022 to delay the onset of type 1 diabetes. This was approved for individuals that are 8 years old and older and delays the body from attacking the pancreas. Within the human body, the pancreas creates insulin, which is a hormone that pushes glucose or sugar into the muscle. The engine within the pancreas that creates the insulin are called beta cells. The drug delays the body from killing these beta cells and allows for, on average, 2 more years for the patients to live diabetes-free. The drug is administered daily for 14 days, and most patients have either none or minor side effects. As we stand today, eventually the body will kill off these beta cells and stop the body from producing insulin, but this is huge if you can delay diabetes. Clearly, this drug is not for everyone, as you need to have some beta cells left in your body, but if you or your child are newly diagnosed, you should ask your endocrinologist about the drug and see if you qualify for it. Additionally, you should check to see if your insurance carrier will cover the drug, as the retail price of the drug is extremely high. The second recommendation for all diabetics is to create a small stockpile of your drug. I kind of joke that it's like the squirrel and the nut pile. In nature, the squirrel always has more nuts buried than they will ever eat over the winter. You, the diabetic, need to follow that same plan. For insulin-dependent diabetics, insulin does go bad, and you will throw it away from time to time. I can tell you that over the years, I've had to throw away some of my medication. If all that you have is enough to get you through that 1 month, then you're going to be in a challenging position, as you need the insulin to live. Thus, I would recommend that when you get your script written, you have it written in such a way that you have a little extra of the drug just in case some of the insulin does go bad, and you will still have enough of the drug to get you through until the script can be refilled. The final recommendation is to make sure that you are up to date on all your vaccines. This is twofold. First, a person with high glucose hinders your white blood cells' ability to fight infections, which can make the body more at risk of getting the disease. Second, even if your blood glucose is well controlled, getting sick can make managing diabetes more difficult. Thus, it's recommended that diabetics keep up to date on all their vaccines, including the flu shot each year, pneumonia, COVID, shingles, hepatitis B, and Tdap, which includes tetanus, diphtheria, and pertussis. Your doctor can help you ensure that you're up to date on all your vaccines. I hope that helps, and if I'm missing anything, please put them in the comment section below.